Thank you. Hi, everyone. My name is Neha Sivakumaran, and today I'll be presenting my research on racial disparities in maternal healthcare in the United States. And I will be focusing specifically on Black women's birth stories in order to highlight recurrent issues and potential solutions. Okay, so as I said before, my name is Neha. I'm from Ann Arbor, Michigan, and that's where I'm presenting from here today. I enjoy stargazing, playing the violin, and dancing. My amazing mentor is Miss Kristen Connor, and I'm an aspiring OBGYN and healthcare professional, and I'm very curious about the limitations of the healthcare field, which led me to this topic. So in order to really understand the severity of this issue, I think it's important to look at a statistic. Even though my title says more than a statistic, I think it's important to know the statistic because it shows how large this issue is in American society. So Black women in the United States are nearly 3 times more likely to die from pregnancy-related complications than white women, regardless of income or education. So the real purpose of my research is to not only just know the statistic, but to also recognize why it happens. And to do that, I believe that it's important to listen and empower Black women's voices. And I think that's really important for guiding reform in the future. And that is actually why, for my method, I chose to analyze real experiences from Black women's pregnancies in the CDC's Hear Her campaign videos. Okay. As we all know, the United States has a very long history of systemic racism in healthcare. This actually dates back to slavery periods where Black women who were enslaved had gone through non-consensual medical experiments without consent, right? And these include cesarean sections without the use of anesthesia. And this is what really fueled the mistrust in the healthcare system today. And even today, Black women face higher maternal mortality rates and pregnancy complications compared to their white counterparts. And they also, like, their symptoms are often like delayed in recognition, and that leads to potentially life-threatening consequences. Okay, so research actually does show that this issue is very well documented. So Dr. Monique Rainford, for example, wrote the book Pregnant While Black, and she showed that physician bias, along with structural racism, does contribute to poor maternal health outcomes. And writer Helena Andrews Dyer for the U.S. representative-run Black Maternal Health Caucus also mentions celebrity stories such as Beyonce and Serena Williams and how they had undergone pregnancy complications in the past, and kind of showing how wealth is often not actually a shield from racial bias, which a lot of people do think it is, unfortunately. And researchers like Millard and colleagues also describe the looping effect, which perpetuates negative stereotypes and care disparities, which unintentionally worsen maternal outcomes instead of improving them. Instead, they advocate for a more strengths-based and community-informed approach that can improve outcomes by really centering these Black women's lived experiences in order to guide reform and improve patient-physician interactions in the future. So the way that I did my research was a manual qualitative coding or thematic coding. So I did a qualitative analysis of personal narratives from the CDC's Hear Her campaign. And what I did was I assigned elaborate codes and labels to transcripts of the videos, and then I kind of boiled it down to like recurring themes that I saw that kept coming up. And I wanted to share this specific quote from one of the patient's stories that I analyzed, Joanna, because in her case, she was diagnosed with postpartum preeclampsia, which is high blood pressure after giving birth. And even when it was necessary for her to get her blood pressure constantly checked in the hospital, doctors would often dismiss her and tell her not to even come to the hospital because they were too lazy to give her the care that she deserved. And she even shows her emotional exhaustion in this quote. I felt extremely unheard. I felt like I was dismissed. I feel like I wasn't being taken seriously. And Joanne is just one of many Black women in the United States that have this kind of negative experience. Along with Joanna, I also analyzed three other Black women's stories. Allison Felix, which a lot of you may know, is an Olympic track athlete, and she suffered from severe preeclampsia at 32 weeks pregnant. And when she was going through this condition, which she had no idea what it was about, her physician didn't really take the time to really be compassionate and help her understand the issue. And even as she was going through her emergency C-section, she experienced a lot of fear and anxiety, and isolation as well. And Joanna, like I talked about before, she had a repeated dismissal of care when her doctors refused to check her blood pressure, which she needed for her survival. And she really received a lot of lack of compassion from the providers that were supposed to give that to her. And then Valencia was not able to understand the kind of resources that were available to her in the hospital, and she often felt very isolated. But from compassion from her primary care physician really did save her in the end. And there was also Sonari who told her doctor that she was going through really severe pain after giving birth, and it was unfortunately misdiagnosed as gas instead of the actual life-threatening abscess that she ended up having. And her self-advocacy was incredibly crucial for this. So her speaking out on it really did save her life. And so out of all of these four stories, I realized that the main three themes that I could find was medical neglect and dismissal of Black women's concerns, how important it is for patient advocacy and persistence, and the positive impact when physicians really listen and advocate for their patients. So these stories are not just stories, they also show that there is change that is available. And I think some of the recommendations that I would say is giving more provider training programs to physicians. So this would like improve more cultural competency in the hospitals and kind of reduce bias. But I also don't think it's just enough to do these programs. I think it's also important to evaluate the effectiveness of these programs, and this could be through anonymous feedback forms that Black women or any women could fill out to make sure that they are not experiencing bias in the hospital setting. As well as that, I think it's important to do some simulation-based training, some hands-on training of it could be even emergency birth scenarios or C-sections with racially diverse mannequins to see if there really is a different response with each patient, kind of like showing if there is actually really bias and if there is that bias on what ways we could reduce that bias. And then, of course, amplifying Black women's voices, as I've been saying this entire presentation. I think it's incredibly important that their voices are the center of this issue because they are the ones that are being affected. So, partnering up with advocacy groups like the Hear Her campaign or the Black Maternal Health Caucus are really, really great resources for that. And then also just continuing to share their stories and raise awareness will really just kind of streamline the guided reform that we need for this very pressing issue. Okay, so to conclude, I would just like to reiterate that it's very important to listen to Black women's experiences to rectify this issue, and to really listen to them and hear them out, and don't dismiss their concerns in the hospital. And also improving that patient-physician communication is incredibly crucial for reform, and also just implementing more of these provider training programs to reduce that racial bias that is so prominent in healthcare today. And this altogether kind of just ensures a more respectful and high quality care for all future mothers and kind of shows that not just Black women, but all women are cared for equally, and they are comfortable during a very vulnerable period of time. Thank you.
That was fantastic, Neha. As a Black woman, I resonate a lot with a lot of the things that you said. Um, yeah, that was amazing. We have a couple questions for you from the audience. What was the most interesting thing you discovered in your research?
Probably that like even though the public doesn't really know so much about this issue, research is actually like very widespread on the issue. I thought that was not going to be the case, because I really only heard about this when my counselor was talking about her own pregnancy experience, and how she had delayed care because she was a Black woman. So really seeing that actually it is well represented in research, it's just that a lot of the public doesn't know about it. And being able to be here today and like talking about it is, I think, a really good step in the right direction.
Awesome. We have another one that came through the chat. So it's kind of similar along the lines, but what motivated you to focus on racial disparities in maternal health care for Black women specifically?
Yeah, so as I said before, I actually had a meeting with my counselor, and she was telling me about the experience that she had. She also had preeclampsia, which was high blood pressure, and realizing how like common this issue was, with someone I actually personally know, and also like on the news and all of that, and really seeing that statistic of how Black women are 3 times more likely, almost 4 times even, of experiencing these pregnancy complications compared to their white counterparts really helped me realize that Black women are really disproportionately affected by this issue. And it kind of got me really interested in it as well as since I am someone who really wants to be a gynecologist in the future, I feel like it's very important to know the limitations in the healthcare field as well.
Well, I think whoever gets you as their gynecologist will be very, 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 very lucky.
Thank you.
And then there's one more that came through. What were some of your biggest challenges you faced when doing this research?
Yeah, so like I said before, the it's only documented in research. It's not really well documented in like personal like narratives and things like that. So really finding first person narratives for my research was incredibly hard. I think the CDC was really the only resource I found that wasn't like third person point of view. It was like first person, like actual experience, like an actual interview. And that was like probably the toughest thing I encountered. And then of course also writer's block when I was doing my paper. But yeah.
Well, this was incredible work. Congratulations.
Thank you.
We thank you for sharing this with us today. And yeah, get everybody give it up for Neha. Silent claps, I know. Thank you so much.